Good morning. Thank you, Dr. Jairam, for giving me the opportunity today. Dr. Jairam and Nimmi has already talked about the pre-op evaluation and the overview of lenticle extraction. So we have been doing lenticle extraction for the last 1 year now. I'm doing silk for the last 1 year. It is there in the practice. Dr. Kudlu and all are doing for the more than 10 years now, I feel. I'll be talking about the healing pattern compared to the already established PRK and LASIK procedures. This is a first day picture of a patient post silk. The cornea looks and the interface looks very clear. Before going into the healing pattern, let me begin with the basic post-op uh, care. After silk procedure, we give a standard regimen of antibiotics for 1 week, steroids we taper over 4 weeks, and tear substitutes we'll be giving for 4 to 6 weeks, and always give eye shield for 1 week while sleeping and sunglasses for 1 month. And patients are instructed not to rub the eyes, avoid tap water, avoid eye makeup for at least 1 month. The post-op outcome on day 0, the patient may feel fogginess, slight spreading. Patient, even though they see 6 by 6 or 6 by 9, but the vision won't be crystal clear on day 1, but still the functional vision improves rapidly over maybe in 1 week time. The vision improves rapidly. The basic physiology of in healing post-op is, as they have already mentioned about the nerve preservation. Unlike in LASIK, we are not making it 300-degree flap. The corneal nerves are not disturbed much. The anterior stromal plexus are preserved, so there is less induced dry eye, and the structural integrity of the cornea is also maintained because the anterior cornea as well as the movements are not disturbed much. So post-op outcome, the visual recovery mainly depends upon the femtosecond laser energy, the spot sizing, the scanning pattern, and the surgical techniques. The day 1 result can be affected by the inherent elasticity of the patient's eye. The heart of lenticle extraction is the energy optimization. The concept of energy optimization is basically to balance the effect of femtosecond laser energy, the tracking distance, the spot separation. When the energy is high, it can lead to OBL formation that can affect the vision on day 1. It can lead to interface haze also, and too low energy can cause more adhesions that we have to give extra energy for the separation that can cause Bowman's membrane damage and lead to again it can affect the vision. So what we are looking for a sweet spot of energy levels where it is not too high, neither low, so that we can have a clean, smooth separation and extraction of the lenticule. And lenticuloschisis is a new technique wherein we don't actually separate the lenticule. It's like a capsulorhexis. We remove the lenticule just after, with a forceps, just peel off like a capsulorhexis so that the manipulation can be reduced. And the trauma to the epithelial cells and the stromal tissues are much less, so that the cytokine release and is also reduced. Similarly, the keratocyte apoptosis proliferation as well as inflammation is much less compared to the LASIK and the PRK procedures, and less damage to the stromal nerves. Thereby it preserves the subbasal plexus and leading to faster visual recovery. Immunohistology studies have shown that CD11B is considered as a marker for inflammatory infiltration, showed that there is distinct difference between post-LASIK and post-CLEX eyes. It is always remained low after CLEX procedure, even with high power correction. Unlike in eczema laser, uh, uh, when we give ablation for higher amount of correction, there is always inflammation is more compared to the lower power correction. There is more release of cytokines and chemokines. And the nerve plexus regeneration is faster because we are not damaging the nerves at like in LASIK. Only at the upper portion there is a 2 to 4 millimeter incision, so the nerve regeneration is faster and less dryness. That will improve the functional vision from day one. Studies have shown that the subaxial fibers start to regenerate by end of 1 week, and there is significant improvement in 4 weeks' time. Similarly, the corneal sensation also begins to regain within 4 weeks and peaks at 6 months. It's a confocal microscopy picture showing the nerve regeneration in PRK, and it is moderately better, but the LASIK, the nerve regeneration is much slower compared to the CLEX procedures. To conclude, energy optimization, we have to find the best energy and according to the patient eye, according to the power, we have to titrate. We have to come to a nomogram, like we have to find our energy parameters. The companies usually give a standard parameters. We'll start from one end, but we have to find out by doing the titrating the energy levels, which is suitable for according to the power. We have to find out the energy levels, which causes minimum tissue trauma to the eye. And definitely the procedure itself preserves the corneal nerves. That will helps in healing and less inflammation. It gives a rapid visual recovery.